Dave Blom is President and Chief Executive Officer of OhioHealth, which is a not-for-profit, faith-based healthcare system here in Columbus and throughout the Midwest. It has 29,000 physicians, associates, and volunteers, and a budget of almost $4 billion. Dave graduated from The Ohio State University. He received his master's degree in healthcare administration from the George Washington University, and then he joined OhioHealth Family of Hospitals and Health Services in 1983, and since then has held progressive management positions until he became CEO 17 years ago in 2002. He currently is serving on the boards of the Columbus Partnership, Columbus Downtown Development Commission, Columbus Foundation, Vizient, Kimball Midwest, Healthy Roster, and he was appointed to serve as a member of the Veterans Affairs Commission on CARE. He has just finished serving as the 2018 Franklin County United Way Chair, and he's also a member of the World Presidents Organization. He lives in Westerville with his wife and has 3 adult daughters and 6 grandchildren. Anyway, Dave, I hope you'll take this in the spirit in which it's intended. You are kind of the elder statesman when it comes to healthcare leadership in Columbus. You've been around for 36 years, with the last 17 as CEO, so you've definitely had a front row seat for a long time. When you think of healthcare in Central Ohio, as compared to other cities somewhere inside, where are we?
Well, the elder statesman thing works about most any topic these days. So healthcare in Central Ohio, how do we stack up? You know, I'll answer that with several parameters, several different categories. So quality of care. We're fortunate to live in a city where all the hospitals are in really pretty good shape. Accessibility. It's a big marker. Columbus has one of the most generous charity care policies in our hospitals of any city. We all got together about 17 years ago and agreed we'd all have about the same charity care policy. We don't have a charity care hospital in Columbus. You know, Minneapolis does, Chicago does, Indianapolis does, Buffalo does. They have public hospital, and that's where the poor people, many of them, get transferred to. Here in Columbus, they use the same facilities as the rest of us, and we have a 200-400 policy. 200% of the poverty level is free. You don't even get a bill. Up to 400%, there's a discount. That's about 38% of the people in Franklin County, by the way. Just think about that. So we take care of everybody. So accessibility is reasonable. Economic strength. I don't know of another city in America where all the hospitals are AA credits. There may be one, I just don't know of any. Now we all get there a little bit different way. Ohio State's on the full faith and credit of the state of Ohio. Mount Carmel's on the books of Trinity Health, which is a national concern. Children's Hospital stands on its own. OhioHealth stands on its own. But the relative financial stability of the healthcare system in Columbus is reasonable. Cost. How does Columbus stack up with the cost of healthcare, the price to you all? And I don't know what everybody pays. I don't know what all the insurance companies' contracts are, but the best proxy I can use is Medicare claims data. And I know what Medicare claims are in this city and against most other cities in the nation. We're between the 50th and 60th percentile. We're about average. A lot of cities more, a lot of cities less. I think ours is going the wrong way, but it is about average. So quality, cost, accessibility. I think we're fortunate to live in Columbus, Ohio, with the healthcare systems that we have.
Why do you think ours is going the wrong way? Can you expand on that a little more?
It's complicated.
Then never mind. Never mind.
But I will do my best to answer because there's not just one issue. Yeah. There's not just one issue. City's growing. I'd say healthcare is becoming more fragmented in certain areas than others. Competition is escalating, and that's driving up the cost. Columbus is getting older faster than a lot of other cities. I can keep on going.
Is our city unique in that we have, and I'll say it's 4 healthcare systems if you count children's as a separate, that are all very strong. You know, there's not little. I mean, is everybody else consolidated down to 2 or 3 or 4 main players like we have?
Most cities have. Chicago hasn't. I think the biggest player in Chicago has about 20% market share. New York hasn't. But markets our size, they have pretty well consolidated.
Makes sense. Well, today we can't turn on the news or even read a newspaper without seeing something related to healthcare. While there are some great clinical advances, we are also constantly hearing issues too. As it relates to cost and access and success, what frustrates you most about today's healthcare system?
I'm not sure I'll use the word frustrate, but I will say what I believe needs to happen to have healthcare be a little more rational. Fair? So people talk about healthcare reform, right? Well, if you're going to reform something, what has to change? The behavior of every part of that element that you want to reform has to change. Every part, not just one part, every part. So if you want to reform healthcare, whose behavior has to change? Well, I'll start with us as consumers. If we want to reform healthcare, we ought to be more concerned about our own health and take some responsibility for that. If we want to reform healthcare, folks like me running healthcare systems need to be a lot less concerned about fuller operating rooms and cath labs and be a lot more concerned about keeping people healthy, not just taking care of the sick and injured. If you want to reform healthcare, how about the doctors? The doctors don't make money unless their offices are full and they're seeing a lot of patients. If you want to reform healthcare, their incentives ought to be aligned with keeping us healthy and well and minimizing the use of the acute care system that we have and more focused with prevention and wellness and all that. How about the insurance companies? What is their role in all that? Well, very few insurance companies actually take risk anymore. They're more network managers. And the more complicated healthcare is, the more money they make because we need them to keep the network together. So who really is concerned about having a less costly, more simple, high-quality healthcare system? Who really is concerned? Well, it's the people paying the bills, and who's that? It's the employers. And that's why I believe here in Franklin County and in Columbus, the best shot we have at reforming healthcare lies with the employer community, not the government. The government's not going to reform healthcare. It's almost impossible. There's too many political motivations, too many lobbies to keep it just the way it is. And I believe in many communities you're starting to see the employers community drive healthcare change. And it's happening here in Franklin County where you have employers contracting directly with organizations like ours where we have aligned the incentives of the employee, the employer, the hospital, the physician, and the administrator of the function, all having their incentives all aligned to have the system be more rational. And I believe that you'll start to see the cost trajectory trend down with that prospect rather than others. So why am I bullish about Columbus to do that? Well, one is Columbus, of all the cities in America, has the highest percentage of employees in self-funded administrative service organization plans, because we have a lot of big employers. So in this market, we have a shot of working with employers to change the trajectory of the health spend because of the nature of large self-insured employers. I believe that trajectory will occur, And give it 5 to 7 years, I think that we will see a change.
That's fascinating.
That's a long answer to your question.
Were you guys aware that OhioHealth did that and was working directly with businesses? I remember hearing about it a while ago, but I didn't know that much.
It's just getting started. It will be an evolution over time, but one that we are committed to, and a lot of employers are just looking for help. So one thing I hear from employers is they feel like they're a victim of their health spend. I can't do anything about it. Every year goes up 7%, 8%, 9%, 10%. I can't do anything about it. It just is. And my answer is, if you had any other area on your budget where you had escalation in cost or price of 7, 8%, wouldn't you pick the best person in your organization and put them on that problem? And not too many employers think about it like that because they think they're victims and they have their benefits department do it. And a lot of employers are putting their best people on this problem and are changing it.
And since most of us are from small business or family business, we have 200 associates. Many in this room have less. Is it a chamber? How do the littler guys help with this?
It needs to be aggregated in groups of 1,500 or more. Otherwise, it's difficult for us to take risk if you don't have at least 1,000, 1,500 people in it.
Okay.
So vehicles to do that, I believe, will emerge. And I think the insurance companies will get there eventually. Once the big employers start to move, the insurance companies will have to move.
Did you hear that, Mr. DePero? Okay. Glad you're here. I thought you might have an insurance plan at the Columbus Chamber of Commerce. You pay that fine. Dave, you are both a provider and a consumer of healthcare, as you mentioned, and with the 29,000 folks that are affiliated with you. What do you think is top of mind for you when it comes to healthcare for your associates? Can you share with us?
I think I just described it.
Okay.
Because the one group of people in town that we do have economic risk for is our own people.
Right.
And so we are piloting a lot of things that I'm talking about with diabetes care, et cetera, with our own employees. And when you invest, and when you set up a program, and when the employee enrolls, and you have the physician on board helping you, our diabetic employees, their healthcare costs drop about $2,800 a year per person.
Wow.
So the incentives are aligned.
I know wellness is a big thing that a lot of companies have done to try and get healthier, to reduce their healthcare costs, and it's hard when you invest the money today and it costs you money today to think about, well, this might be a benefit 5 or 10 or 20 years from now. Are there examples you know of where wellness has really, there are people that can say, I can show that this is saving me money? Is there?
I can show you that.
Okay.
It's funny though, with employees, why don't they just, if they're diabetic and we pay for all their drugs if they're diabetic and they know they're going to be healthier, why don't they all sign up for the diabetic prevention plan? It's just human nature because they're not in trouble today. So we actually pay our employees if they're diabetic to get on this plan, cash incentive to do it. It seems contrary to what you need to do, but it's what you need to do right now.
I know my uncle years ago gave a $100 bill to anybody who quit smoking, and we still have 2 employees who 15 years ago quit smoking and still have that $100 bill in their wallet. They won't spend it as like a gesture, a token of that what decision they made to get healthy. So similar. Well, you've been around OhioHealth for a long time, and I wish I knew what the number was when you started and what it is today, but I'm sure it's exponentially larger. You've seen significant growth. What was the secret sauce that helped you see so much successful growth?
It's several things. One is it's the market we're in. Healthcare is just consolidating all over the country. So I was fortunate to be there at the right time. Timing's everything, right? So I happened to be there at a time when consolidation was occurring. And it's occurring, it will consolidate a lot more than it has. So who's been successful at that? The OhioHealth Board of Directors in 2002, if I look back and say, what's the biggest decision that was made since while you're CEO, which is 17 years of, the biggest thing that we did was consolidate all of our boards of directors. When I started, we had 72 board members on 5 boards. And all I did was, you can just imagine, bounce around from board to board, and this board wanted to do refinancing, and this one didn't, or, we just swirled. Do you all remember Jack Chester? Yeah, you remember Jack. So Jack was my board chair. And we were sitting there after 1 week of a lot of board meetings, and he looked at me and said, David, this is crazy. He said, we ought to be less concerned about how Riverside does or Grant does or this hospital does, and we ought to figure out how we can take these assets and serve the community better. Make sense? Which meant you got rid of 55 board members and you went to 1 fiduciary board. And that was done in 2002. Jack led the way along with Mike Endress, you all know Mike, yeah. And Tom Hoagland, and John Zeiger. And the 4 of us kind of lit into that, and about 6 months we got her done. And what that became was a mandate to the organization to serve the communities better, regardless of which hospital campus it was, regardless of which medical staff it was. Now that created an awful lot of headaches for me right up front, because I didn't worry about just Riverside or Grant or whoever it was. But what that did was set a tone that we're going to serve the communities better, and we came up with this word called systemness that people make fun of. But how do we standardize, consolidate, maximize cost efficiency, make sure the quality is absolutely consistent throughout the system, et cetera, et cetera? And what I just described was 20 years of work. That set the tone for us to grow, because people want to be with a winner. When we went to Mansfield, Ohio, we had a system that would work, and they could see themselves in all that. When we went to Marion, Ohio, so over the course, we're about 40% outside of Columbus now. And what that enabled us to do is go into Marion, Ohio, take on the system. There were 2 hospitals, closed 1, turned 1 into an outpatient facility, set up all the computer systems, so it was easier to refer into OhioHealth in Columbus if you're in Marion rather than going to Cleveland or some other place. And that synergy of taking care of people as close to where they live as possible, with the same standard of care, no matter what, has enabled us to really grow. So Mansfield was 5 years ago, Sue, is that right? So when we acquired the hospital in Mansfield, we were able to move about $40 million a year that used to go up to Cleveland to Columbus. Went to the Cleveland Clinic, UH in Cleveland. And these people now get their care here in Columbus. Caused us to grow, reduce expenses there, much smoother system of care for everyone concerned. Sorry for the long answer.
That's great, thank you. Years ago, when you opened Dublin Methodist Hospital, you gave us all like a behind-the-scenes private tour. I don't know if you remember this, but we were all there. The place wasn't even open yet. The lights were on because we were getting this tour, and literally somebody banging on the emergency room window. We were all in the emergency room. Do you remember that? And they had an injury. And Dave's given this tour to all of us, and this person needs help. But the hospital's not open. There's no doctors in the building. And yet I watched the person, it wasn't Dave, but one of the other people there, immediately went to take care of this person. And that kind of reaffirms your commitment to care and quality. But I think it also represents the culture. They say culture starts at the top. And I hear about it. We're sitting at lunch here with Sue. And Sue worked previously at another facility, another healthcare system. And she just talked about the culture here and how this is my happy place. I mean, this is just, how did you do that? What makes it different? When you run a $4 billion organization, how do you make sure culture gets down to the front line?
Culture is our secret sauce. It's what makes the world go round. It keeps us nimble, keeps people engaged. So how do we do it? It's a lot of things. But there are three things that I think about all the time, every time. We just acquired Burger in Circleville a couple weeks ago, and if you go there, people will kind of talk about this. I think about hands and heads and hearts. That's how I think about it. So, do I have the right hands? Do I have the most skilled talent that I can find? Do we have a leadership development program? Do we have a real development program to make those hands better? Then I think about heads. Do people know what's important? Do they know what the metrics are? Do we know how they measure success? Do they know why this is important to the communities that we serve? Can they find themselves in the work? So how we make sure a social worker finds him or herself in the work is a lot different than how I get our finance team to find themselves in the work. But everyone has to identify with the work and find out how it serves the community better. What's the higher purpose? And we spent a lot of time on the heads part. We have a big meeting 2 times a year, 6 hours, a lot of training, a lot of education, a lot of transparency. People know what is important. And then the last one is hearts. That's all about recognition. That's all about feeling it. If you have those 3 things, if that's a kind of test I use if we're going to roll out a brand new computer system or open up a new wing or start a new service, that's kind of how we think about it. With the right talent, do people know why it's important, and can they feel it? And if you do that, you can do almost anything. You can do almost anything because you've got the nimbleness and the engagement of your 29,000 people. Is everybody?
That's a great
No,
takeaway.
but that's something that I kind of think about.
Wow, thank you. Well, leaving OhioHealth for a second, you've been a big driver of the economic development of Central Ohio. You've been a part of the Columbus Partnership from the beginning. I think of all the work you've done to just make our region better. Do you want to talk about that at all?
Yeah, it's been a big part of my career here. I got really good advice years ago when I became CEO. I called a guy named Tom Breitenbach from Dayton. He ran Miami Valley, and he was a guy I really looked up to. He's kind of a mentor in certain ways. I became CEO, and all of a sudden people want to be on the Heart Association, all these boards, and I called Tom and said, what do I do? He said, find one thing and go deep. Don't go broad. So I decided economic development for the city of Columbus was something I was going to focus on. So whether it was the chamber or the partnership or CDDC or the Columbus Foundation, those are the things where I've kind of put my heart and soul and try to find a way in that area to engage the city more broadly than it was. And I have had some great partners with Don and Alex Fisher and Guy Worley and Doug Kreidler and other people that preceded them in their roles. And it's been very fulfilling, actually, to look back and see the progress that the city has made in the private and the public sector working together in a fairly integrated fashion to advance. I still remember when NetJets was going to leave years ago. It was the darndest thing. So the partnership was going to have a dinner to court the NetJets execs not to go, and the chamber wanted to have a dinner to court the people, and we were told, the partnership wasn't going to invite the chamber people, the people weren't going to invite the partnership, and there was this big cabal as to who was going to be responsible for that. And I looked at it and I said, this is nuts. we ought to be working together on all this. We couldn't figure out a logo for the city of Columbus. So in those years, about 15 years ago, we all got in the same room and decided we need to be working together. I take no credit for that. I was just part of the group that worked on that. But to see where we were and where we've come to with the collaborative spirit that we have, it's a huge difference, and it's making a difference.
Well, Columbus is better for it. Thank you. Last question. I've got several others, but I want to give the audience time to ask a few. Your replacement, Dr. Steve Markovich, is starting July 1st. The board appointed him at your recommendation. Why Steve?
So it's about a little over a year ago where I decided it was going to be time for a whole lot of reasons I won't go into. But the board went through a process of deciding, do we go outside or do we do inside? And why would you go outside? Well, if the strategy wasn't good, if the culture was lousy, or the operations weren't working, those would all be good reasons to go outside. But if you agree with the direction, operations are rock solid, and the culture's good, maybe we ought to look inside. So we got through that exercise. It was harder than I just said, by the way. But we got through it, and the board said, we ought to stay inside. And I said, you got one really good person inside that I'll bet on, and that was Steve. So Steve is a family doctor, engineer first, F-16 pilot, two-star general in the Air National Guard, MBA, and a family doctor. I've done nothing in my life, really. And he's going to be the guy. He's going to be the leader. And I've got all the confidence in the world that he'll do just great. Takes a little time, but my goal this year has been that this is as smooth as possible. My number one goal this year is to have this transition be smooth. So there's no moment of paralysis. Everyone knows who to go to when. And it's like there's not a cliff, it's a ramp. And I'm almost to the bottom of that ramp. And I'll make a hard left, and Steve will be in charge, and I believe the organization will just march on smoothly.
Well, I wanted to ask you, speaking of that, you know you've got power when you can move a freeway. And I've never been able to do that, but we probably don't have time. But next time Dave comes back, we'll talk about how you move a freeway. But anyway, let's give the audience a chance to ask some questions. John?
Yeah, you may be the one to have the answer to this, but how does the hospital justify a classification of someone as for observation, which means the insurance company's not going to pay for it?
So the title observation comes from Medicare. And it's a financial title, not a quality of care title. So for certain diagnoses, certain amount of time, you have to declare the patient observation. Now, the amount of resources we use in taking care of those patients and how they get cared for is exactly the same as if they were an inpatient. We just get paid 50% less. And it creates all kinds of challenges for the patient with nursing home care later and all that kind of stuff. But that is nothing we have any control over other than having to follow the guidelines. Now, in a few of our hospitals, 60% of the patients are observation. 60. At Riverside, it's about 38. Grant, it's about 41. But the lesser acuity setting you're in, the greater percentage of patients you're going to have to be is observation. But it's an economic definition, period.
Couple more quick questions. Jack?
Yeah, Dave, we found out different generations, let's call it from boomers to X's to Y's to millennials, relate to services differently. What's the future of telemedicine and how do you prepare for that?
So that's a great question on telemedicine. It's going to boom. It's going to boom. Right now, no one wants to pay for it. The new federal budget They're going to start paying for it a little bit. Commercial payers pay for it some, but I think it's going to boom. It's part of the reason it hasn't grown as fast is it's a very fragmented industry. So you've got mom and pop telemedicine providers, not a big consolidated one that can actually invest resources. But my prediction over the next 4 or 5 years, it's going to boom, because part of the cost problem I was describing earlier can be mitigated by taking care of people in settings other than in a high-cost acute care hospital.
2 more. I saw CK, and we'll do Millie. CK?
Dave, could you address the impact of regulations on your growth of administration?
Pardon me? I'm sorry.
Regulations on the growth? Is that what you said?
The growth of admin needs.
Oh, yeah, there's a lot of regulation that doesn't need to be there. Lot. I can pick any one of these tables that can say the same thing, but it's made it more complex than it needs to be. Much more complex than it needs to be. I don't know how else to answer it.
Sounds like that's a long answer we don't have time for. Millie, last question.
Thank you for being here, first of all. I appreciate it. Can you tell me what your hospital network is doing in response to what happened at Mount Carmel with the overdoses that had to spike your interest in what your network is doing as well?
So for the TV, the question was, what is OhioHealth doing in response to the Mount Carmel challenges that they're facing currently?
Got to be careful with this one. I'll give you a direct answer. So yeah, you hear that, and you think, oh my God, how can that happen? And then you feel it's tragic for everyone concerned. It's tragic for the patients, their families, the employees at Mount Carmel. I think about Ed Lamb over there. I said, oh my God, I'm glad I'm not in his shoes right now, having to go through it. It's tragic. It's tragic. So once you get past that, you go back home and you turn every rock upside down, right? And you make sure that the alert system works, and you look at standing orders for how much can be administered. You look at the credentials. You look at the culture. Are our people people willing to ask the difficult questions from people in higher authority than what they are? And you go through all those things. And we have. And one of the prouder moments I've had over the last couple months was going out on the floors and pulling a nurse aside and asking her or him all those questions. Are we perfect? Absolutely not. Could it happen with us? I don't think so. But yeah, you turn over every rock to make sure it doesn't.
All right, let's thank Dave Blom for being with us today.
Fellow Rotarian Dave of over 15 years, thank you for your service to the community and that you'll stay in the community. Dave mentioned that he had three children here, 6 grandchildren, and by July we'll have 8 because one's expecting twins. So the good news is we'll keep Dave in this community for the asset he's been, not just at OhioHealth, but in the community at large, as he shared. And we may see him more often after the twins are delivered and everyone recovers, because he will retire end of June from the CEO role of OhioHealth. Thank you for your service. Thank you for being here today. We have our rate on a scale 1 to 5, where 5 is the best, 1's the worst, the speaker and the topic. Did you attend today because of the speaker? Do you wish you brought a guest? And just like we had Jim Bishop do with Dr. Pete Edwards of the crew, I said make 2 columns. Make one on our guest, actually our fellow Rotarian keynote speaker today, Dave Blom, and also the moderator. Last time I gave Pete Edwards a 5.0, and I gave Jim Bishop a 4.9. He really did a great job. So Mike's probably going to work on getting a 5 today. But love the interview style and the moderation. And personally, our son trained at Riverside for 5 years, then went to Charlotte for a year of advanced fellowship training, came back last August, and we're not just beholden to OhioHealth for bringing our son back now as a full-fledged attending surgeon, particularly at Riverside, but it required him to bring our one grandchild back from Charlotte, so that was a particular blessing. So very much indebted to Riverside. I have the hat on only as I had it on before, and hope you and others are here a week from Monday. With that, be the inspiration, and have a blessed day.